Good morning again. This is Dr. Bill Wyatt with the American Orthodontic Society, and I want to go over a really neat thing we do with missing bicuspid. Missing lower second bicuspids is the neatest thing. So if you haven't seen this, we have another one on it. Look at this. It is not that difficult to do, and it just plays out. You just hardly know that anything was done. So let's start off here with this young man. He has two different problems. One thing he's missing is permanent laterals, and he's got one defective one there. We're going to take it out, and we're going to use his cuspids as his laterals, but I don't finish that part. But I want to show you what happens to the second bicuspid on the bottom arch when you're missing that tooth. If you do this, it is a neat thing to do. So I'm going to go ahead and start off here. Let me see if I have to get this young fella going. All right, this is a teeth. He has a lot of different things wrong with him here, but the main thing I want to show, excuse me, or really the only thing he'll be showing you be these bicuspids on the lower arch, the second bite. A real nice looking young fella. And here's the way his teeth are. Got some discoloration on there. And so we go in and actually are planning to shape up his permanent cuspids, upper cuspids, and make them look like laterals, but I don't have any pictures on that. All right. Now here we've already gone in. What you do in the case where you're missing these permanent bicuspids, second bicuspids, you go in early, but you've got to make sure you're not going to have the permanent bicuspid in there. Then you also want to know if you're going to have the wisdom, the second molar, and your wisdom teeth back here. We don't actually use the wisdom tooth here. But then we know we're missing this. We come in and do a hemisection. Just cut the tooth half in two. Just literally do it. You can kind of round it off if you want to, smooth it up where it's easier. And this has already happened here. This 6-year molar will be back here. You cut this in two, take this part of this baby tooth out, and this 6-year molar drifts forward into this space. Now when it gets forward here, then that this tooth holds the upper tooth up and keeps it from dropping down, and then this drifts on and closes. When this happens, then you come in and take the bottom half out, and this tooth will actually come up and fill in the space down here. Now, in this particular case, we had a patient, as well as a dentist that had attended the lectures and everything, but he decided he didn't want to do the popautomy on the tooth. He was kind of afraid to do that. So he sent the person back. It wasn't myself doing the popautomy. He sent this patient to an MD, DDS, who was, an oral surgeon, is also a medical doctor, and thought he knew how to do this, but he didn't know how, and he just kind of patched up these deals, and these teeth went bad, but the thing worked anyway. I mean, it worked even though the teeth went bad. If the guy had done the popautomy properly, it would have been an ideal case. Now let's go ahead and get into this. Here he is. It just says he's 13 and 3 months. 13 and 3 months old. And this is this cephalometric picture. You can see the permanent cuspid in this area right here is gone. And so we're going to take this tooth and shave it up and make it look like a lateral and bring it down in there. Well, when it gets down in there, we'll do that. Here we'll take this out, and you end up taking this out. And when this gets down here, you will shape it up into a permanent lateral also. Now down on the bottom, this young man has no second bicuspid here. It's absolutely gone. So when you know that's there, we see wisdom teeth there and another place, but we're not going to use those teeth. So we come down on the bottom arch now. My voice is kind of going bad on me, but you just section that tooth in half, come down to the popautomy on this area, and pack that zinc oxide and eugenol down into that opening like that. Just pack it in there, pack it in amalgam. You got to mix the stuff. It's a thick. You can pack it like amalgam, just about the same, and pack it. Now, when you take this out, this tooth right here will start to drift forward. Now, this piece that you left will hold this tooth up. And you'll have to pay attention to what I say, even though I'm saying it's not very clear. But you take this back half out on this. You keep this piece of this half of the tooth keeps this tooth in place. And then holding that there. And so now this tooth down here will drift underneath there. When it gets underneath here, then you can take this piece of tooth out right here. And this tooth here will end up there. And it'll look almost like it just started there. So this is a very neat thing to do. Let me go back here. So here we go along. He's nearly 13 years old. Well, I'm sorry, this is 31. He's nearly 9 years old at this point. Now, we still didn't do this, but we told him we would. We were going to do it. So we'll take this out, and we're just waiting. It's just what we call driftodontics. We're just going to let this tooth here will actually drift all the way up to that point right there. Now let's go ahead. All right, we take that tooth we actually just cut it in half. We take that half out and leave the second half. Now you put a little zinc oxide and eugenol in this hole, but you need to pack that stuff. I mean, it'll go way down in here. And I'm not pulling your leg, but I do believe during my whole lifetime. I've been doing these popautomies for years. That I've done way over 1,000 of them. And honest to God, I've never had one of them go bad, and I used nothing but an extremely thick mixture of zinc oxide and eugenol. And they put something over here, but it didn't hold. The guy just didn't know how to do this, even though he's an MD, and he's a DDS, and he's probably smarter than heck. And he probably charged him a big fee, but it didn't work as far as the tooth blowing up. But anyway, it blew and drained, but it still worked. You see how, all right, we've removed this. Now watch this tooth move over in this hole. This piece right here is holding that, and this will drift right over there. This part right here, there, and this will come right over in that spot. Without touching, we haven't put anything in here. We're actually changing positions in that tooth and not using anything I can remember on that. All right, same place. All right, here it is, 12/6 of 95, and he's 13 years old now, and we've done nothing on him except prepare some room. Now this tooth right here went from here somewhere and went all the way up to that point. And when he gets there, we're going to take this out. Take this out, even though this tooth abscessed on him, but it drained and didn't cause any big problem. And so I'm still showing it, but I've made a mistake letting this oral surgeon do the popautomy on there. That was a mistake. Now we'll go ahead. Now, that tooth is touching, so we clean this out, clean all this out, and it heals and does perfectly fine. And this young man is 13, nearly 14 years old at this time. This is 96, and this tooth will drift up to this place. Now, we left this banded tooth here so that if it started tilting too much, I could come in and put an arch wire and just bond something onto these teeth right here and put a loop in this and have this kind of angle down. Come out here and make your loop. And this would be angled down this way. Run it through here, and then when you band this one, run it through there too. And that would straighten this root, pull it on out further. But I didn't have to do that. This moves without anything. Okay, we go back now, and this is, he has only this upper deciduous molar over here and this one right there, and we'll shape these up into laterals, and this place will look like you've done nothing almost. Okay, now here we've brought this up to that point. We put a regular arch wire in, and you straighten this up, and now this is moving up. So we have used appliances to finish it out, but we got this tooth to come forward from way back here to drift up to that area by just preparing some space for it. Here we've got these cuspids coming in, and we bring them down in place and we have them trim them up. But you do 5 areas only. You trim them across here. Then you thin this out in this area. You trim a little bit in here. And you close that together, and you have to torque them properly. And you can hardly see them. I've got cases where we've done this to people 20 and 30 years later. Some of the cases you can actually see those going. Voice again so bad, I hope you can hear what I'm saying. Now that's back in 95. So we're pulling the teeth together there in front. Now we put a little block of acrylic under the front teeth right here. That lets them rest on that. So it holds it pretty much in place, where we'll move these others and close this, close that gap. Here we are in 95. Now this is right after the 6-year molar moved up to here. Now we rounded this one off and left this one square. And there it is at that point. And here it is in 1997. And we have shaped these cuspids up so they look pretty much like laterals, and put them in the proper place, and gave this case an overjet, an overbite, an overjet, or when he goes out here to bite, his front teeth touch, but the back teeth don't touch. And this is a neat thing to do, and somebody looking at this case down the line will not actually know that that second deciduous, that second bicuspid is not there. Well, it just won't be there. So we go on, and now this is the case after it's pretty well finished up. This is actually, well, this is the first molar, and this is the second molar. And I don't think we waited around for the wisdom teeth to come in. So that's the first molar, second molar on the bottom arch. And here is the young man that we finished and started out. And this is one of the most interesting things, to watch nature move those teeth in place. So I hope you've got something from this, but if you're ever actually missing the second bicuspid, then this is the neatest thing to do. So thanks for watching, and I hope to hear you again, and maybe my voice will come back better. I had to have a sinus drained, and it's like a lot of other old people, things go wrong with you, but I'm still there, and I'm going to try to continue to do these videos as long as I can. And I thank you for watching, and I hope you'll join our group and stay in there with us. Well, I'll say goodbye, and I'm going to go ahead and stop this.